Grab your red loop band and bring it around your ankles, coming to stand by a wall, bar, or counter. Hold on to that wall, bar, or counter. Outside hand on the hip. Inside foot comes into the band. I want you to not only kick that arch of the foot into the band, but take your leg in the hip socket and turn it out, which means external rotation away from the body, pointing the toes. Soften your supporting knee. Bring your torso upright. Imagine wearing a backpack of cement. Pull the navel in towards the baby. Lift up on the muscles that stop your stream of pee. Inhale, prepare. Exhale, small staccato lifts and lowers of the leg. 2, 3, 4. Inhale, pause the movement. 2, 3, 4. Exhale, lower lift. 2, 3, 4. Inhale, pause the movement. 2, 3, 4. Exhale, lower lift. 2, 3, 4. Inhale, pause. Hang in there. Keep your torso upright. Gaze soft. Shoulders plugged down. Low belly in. Soften the supporting knee. One more. Slowly turning around to the other side, setting up. Now that outside hand, it could be behind the head. It could be just straight at the side or on the hip, whatever feels better. Make sure your supporting knee is soft. Your hips are square to the wall in front of you, so you're not sitting into one hip. You're not twisting in the pelvis. Those bony protrusions of the hips are shining like headlights to the wall ahead. The extended leg behind you is straight. Don't lock out in the knee, though. Little micro bend in the knee. Toes are pointed. Plantar flexion. Widen your collarbones. Soften the sternum in. Inhale, prepare. Exhale, little pulses up and down. 2, 3, 4. Inhale, pause. 2, 3, 4. Exhale, pulse. 2, 3, 4. Inhale, pause. 2, 3, 4. Exhale, pulse. 2, 3, 4. 3 more sets. Inhale, 2, 3, 4. And exhale, 2, 3, 4. We inhale, 2, 3, 4. And exhale, 2, 3, 4. Let's do one more. You got this. Come on, push yourself. And exhale, 2, 3, 4. Take that band off. I know those are killer, really building up the strength of the outer hip. Grab a chair now for some wide leg chair bridging. Make sure it's against a wall, bar, or counter for your safety. You'll sit on it, walking back to where your upper back is supported. Your legs are wider than hip distance, kind of like you're at the gynecologist, feet in stirrups. Subtle external rotation. Hold at the top. Inhale 1, breathe. Exhale 1, and lower down. 2, 3, 4. Inhale, lift up, hold. Exhale the air out, and lower down. 2, 3, 4. Inhale, lift, and hold. Exhale, lower. 2, 3, 4. Inhale, lift, hold. Exhale, lower. 2. Keep that going, lifting, holding at the top, feeling the deep lift way below the belly button on the muscles that stop your stream of pee. If you're feeling any knee twinges, just make sure you're activating your core and turn your feet in. Perhaps you're turning your feet out, and we want the rotation to happen from the top of the hips. And it should be subtle because the ligaments get really supple when you're pregnant, and we don't want to overstretch or do anything to pull on those supple ligaments. Keep it narrow. Keep the external rotation subtle. Continue going. We just have another 20 seconds or so. These should feel so good, building up the outer glute and lateral hamstring strength. As you go up and down, notice if your feet are rolling in or out. See if you can equalize the pressure between all the metatarsals. And if you feel back pain, by all means, come out of it. But you can also really check in with your abs and make sure you're pulling the belly in. You're actively lifting up on those muscles that stop your stream of pee. Give me one more. And then I like to put my hands on the ground and slowly lower down. And then carefully make my way back up to standing very slowly as the blood pressure can go a little crazy as you lower and lift when you're pregnant. Take your time coming up. From here, you can set the chair to the side. We'll use it again in a moment, but for now, I'd like you to grab your green loop band and put it around your ankles. The green loop band. Come back to your wall, bar, or counter, placing a hand on it. The other hand can be at your side, on the hip, or behind the head. Kick the inside foot into the band, and now I want you to fully extend that leg behind you, and this time it's parallel, completely straight. Point the toes, and with the leg straight, the extended leg straight, we're going to bring the heel towards the butt. With the toes pointed, the band is around the arch of the foot. Watch out for forward leaning. Put your backpack of cement on. Pull the shoulder blades together. Soften your supporting knee. Widen that collarbone. Lift the chin. Gaze is soft. Continue on here. Make sure you're breathing. So, like maybe a 4 count inhale. Exhale, curl. 2, 3, 4, and lower. 2, 3, 4. Just make sure you're not doing this too quick because this is a strength exercise and I want you moving as slowly as you can. And there's a tendency for the knee to bend quite a bit, which makes the exercise much, much easier. So I'd encourage you to straighten that leg as much as possible, pointed toes, and try to bring the heel to the butt. If this is a really big challenge, you can go back to level 1's orange band. There's no shame in taking an exercise back to level 1 if you're unable to do it with the current band level. Okay, let's slowly make our way to the other side, setting ourselves up for success by bending our supporting knee, finding out where we want to put that hand at our side, on the hip, behind the head, putting on our backpack of cement, bringing the arch of the foot into the band, extending it behind us, watching out for the forward lean. Imagine hands on the shoulder blades, puff the shoulder blades back to those hands, lift your chin. Gaze is a little higher than eye level. With that straight back leg and the toes pointed, we can take the heel towards the butt. 2, 3, 4, and lower it. 2, 3, 4. Inhale, lift. 2, 3, 4. Exhale, lower. 2, 3, 4. Stay connected. Drive all movement from lifting way up below the belly button on those muscles that stop your stream of pee. Stay active there. Keep your breath work going. Inhale and exhale. Again, inhale and exhale. And give me 2 more. Inhale, lifting. Exhale, lowering. Inhale, lifting. And exhale, lowering. I'd like you to take off that green loop band, pick up your purple loop band, bringing it above your knees. With the purple loop band above your knees, you'll sit on your chair, and we're going to take that chair back by the wall bar counter, push it against the wall, and we'll come back into a glute bridge, but this time with our legs hip distance apart, feet parallel. Parallel legs, hip distance apart. Once you're set up, you'll lower yourself down. 2, 3, 4. Inhale, lift, hold at the top. Exhale. Take another inhale and slowly lower down. So we have a full inhale and exhale at the top. Do it with me. So inhale, lift, exhale the air out, holding at the top. Inhale again. And exhale, lower yourself back down. One more time. Inhale, lift. Exhale, hold, lifting up way below the belly button. Inhale, stay up. Feel the pelvis pulling towards the wall that's in front of you, towards your knees in opposition, lengthening the side body. Exhale, lower. Keep going with that tempo. I'll remind you of your checkpoints, which help you do this exercise safely. Really connect with your breath here. Those hands can be on the hips, holding onto the chair, at the side of the body, resting on the thighs. Just get them out of the way so you can focus on the movement you're doing. Lift your low belly in and up. Stay aware of if you're switching into belly breathing, pushing the belly out, or if you're actively pulling the abs in and really recruiting way below the belly button, that TVA. Give me 1 more and slowly walk your way back. You can actually sit down, hands to the floor, sit down. Take off that purple loop band, setting it to the side. And we'll pick up our green loop band and come back to sit in our chair. Great job.